Hi guys, Dr. Mandi McCoy here. If you've been following, again, we've been doing pregnancy a little bit week by week, and this week we have week 12. This is officially your last week in your first trimester, so week 13 officially starts your second trimester. So as far as the signs and symptoms go, they're pretty much exactly the same as last week. You might again have that achy feeling around the stomach as your stomach's growing and your belly's starting to form. Some nausea, which you probably had throughout already. Your mood swings might be going off again, and some tender breasts like you've had on and off, and some heartburn as well. Now, what's happening with baby this week? With baby, the thyroid is officially formed in their neck. Their bone marrow is producing white blood cells. So if you don't know what white blood cells are, those are the cells that our body produces in order to fight off infections in our body. We're starting to get production in that in the baby so that they're able to fight off their own infections. Now, all of our organs are officially formed in the baby, but now they're starting to develop more. So the muscles in our digestive tract are starting to strengthen more and more, so this will be good whenever it comes time for a baby to feed, because they want those strong muscles in order to digest their food properly. Now this week, baby's officially the size of a kiwi, so they're starting to grow more and more each week. Although, even though they're big, or getting bigger, they're still only weighing about ½ an ounce right now. So that's kind of all that's going on in week 12 of pregnancy. I also want to talk about kind of what we do here for you during your pregnancy, your first trimester, since now we're officially at the end of it. Typically, if you come in with no complaints at all, I put you on what I call my pregnancy schedule. So that means is during your first trimester, you'll be about once a month. Just because your body's still going to go through different changes, your body's getting used to a growing belly, a growing baby, so we want to make sure everything's moving properly. And I do a specific technique called Webster's. So what that is getting your pelvis ready for childbirth. So we want to make sure your joints move properly so everything opens up, your specific muscles, ligaments, tendons, all of those are nice and relaxed. So when it comes time for birth in about 28 weeks, everything opens properly and it'll help kind of decrease your labor time, make your push a lot stronger. So we start a lot of things there. I start you on some nice easy exercises, like we work with Kegels. We really want to focus on strengthening that pelvic floor, because those are the muscles, when they say push, those are the muscles you want to push. So the stronger they are, the quicker you're going to get baby out. So that's kind of how we start. And again, the monthly thing is only if you aren't really having any issues. If you're having some sort of pain, completely different story, and that's going to be different from person to person. But we kind of typically see once a month in this trimester. If you have any questions about kind of what's going on in your first trimester or any more about Webster technique, give us a call here. Until next time.